Hello, dear friends. Welcome to our health channel for those over 50. Today we'll discuss the 7 most common health problems that can arise after 50, and most importantly, how to prevent and control them. After crossing the 50-year threshold, we enter a new stage of life that can be filled with energy and joy if we pay proper attention to our health. Did you know that nearly 60% of people over 50 face high blood pressure? And more than 50% are treated for high cholesterol. But don't worry, most of these conditions can be successfully controlled and even prevented with the right approach. Problem number 1. High blood pressure. Hypertension ranks first among chronic diseases in people over 50, affecting nearly 60% of this age group. What makes this condition particularly insidious? You may not know about it for years until serious complications arise. As we age, our arteries become less elastic and the pressure inside them increases. Additional weight and stress, which often accompany middle age, can also contribute to increased pressure. How to prevent and control. Maintain a healthy weight. Losing just 10 pounds can lower blood pressure. Regularly manage stress through meditation or other relaxing practices. Limit salt and alcohol consumption. Exercise daily, including moderate-intensity aerobic activities. Check your blood pressure regularly. The earlier you detect pre-hypertension, the better your chances of preventing high blood pressure. Problem number 2. High cholesterol. More than 50% of people over 50 are treated for high cholesterol. This condition occurs when excess bad fats accumulate in the body, leading to clogged arteries and potentially causing heart disease. How to prevent and control. Abstain from smoking and excessive alcohol consumption. Be active every day. Control your weight. Minimize saturated fats and trans fats in your diet. Problem number 3. Diabetes. 27% of older adults are treated for diabetes, a condition that occurs when your body is resistant to insulin or doesn't produce enough of it. The likelihood of developing diabetes increases after age 45. How to prevent and control. Follow a healthy diet. Controlling carbohydrate and calorie intake. Exercise for 30 minutes 5 times a week to maintain blood glucose levels and control weight gain. Safely reduce weight by 5 to 7% if you've been diagnosed with prediabetes. Problem number 4. Ischemic heart disease. Nearly 29% of older adults are treated for ischemic heart disease, caused by plaque buildup that narrows the arteries leading to the heart. This reduces the amount of oxygen-rich blood reaching the heart and can cause complications such as blood clots, angina, or heart attack. How to prevent and control. Avoid saturated and trans fats. Limit sugar and salt intake. Sleep 7 to 8 hours every night. Manage stress levels. Perform regular cardio exercises. Abstain from smoking. Discuss major risk factors with your doctor, including high cholesterol and high blood pressure. Problem number 5. Osteoarthritis and joint problems. Osteoarthritis is one of the most common conditions in people over 50. About a quarter of Australians aged 50 suffer from back problems. This condition causes pain and stiffness in the joints, which can limit your mobility and affect quality of life. How to prevent and control. Maintain a healthy weight to reduce stress on joints. Perform low-impact exercises such as swimming or walking. Strengthen muscles around joints for better support. Use proper lifting techniques. Consider glucosamine and chondroitin supplements after consulting with your doctor. Problem number 6. Osteoporosis. Osteoporosis causes weakening of bones and can lead to fractures. It affects about 54 million Americans aged 50 and older. This condition is especially common among women after menopause. How to prevent and control. Follow a healthy diet rich in calcium and vitamin D, both necessary for strong bones. Regularly perform weight-bearing exercises such as dancing, jogging, or climbing stairs. Avoid smoking and excessive alcohol consumption. Consult with your doctor about the need for bone density screening. Problem number 7, cancer. In 2022, about 23,000 people aged 50 to 59 were diagnosed with some form of cancer. Of these cases, 4,523 were breast cancer, 3,124 were prostate cancer, and 2,803 were melanoma. How to reduce risk. Regularly undergo recommended screening examinations. Maintain a healthy weight. Limit alcohol consumption. Avoid tobacco in any form. Protect your skin from the sun. Follow a diet rich in fruits, vegetables, and whole grains. Remember that most of these conditions can be prevented or controlled through a healthy lifestyle. Key points to remember. Check your health regularly. Maintain a healthy weight. Be physically active every day. Eat a balanced diet. Avoid smoking and excessive alcohol consumption. Manage stress. What steps are you taking to maintain health after 50? Share in the comments below. Don't forget to subscribe to our channel for more tips on healthy aging. Thank you for watching, and see you in the next video.